Welcome to a school year like no other. In this video, I will cover as many components of our District Health Services Plan in hopes that we all have a better idea of what to expect as we return to our buildings. Hopefully, next August we will be back in the comfort of the PAC, sitting side by side and listening to my ever-riveting in-service on bloodborne pathogens. Who ever thought we would miss that so much? In creating this plan, we have received guidance from the Centers for Disease Control, the Kansas Department of Health and Environment, and the Douglas County Health Department. This plan could be ever-changing as we continue to navigate the pandemic. As staff enter a district building, you will need to enter through the designated entrance of that building. Staff may monitor their temperature at home or check their temperature with the infrared thermometer at the entrance. Whether you check at home or at the entrance, all staff must log into the wellness log and answer questions. If you answer yes to any of the questions, you will need to return to your car immediately and notify your supervisor and myself. By the start of school, 594-7426 or it's 594-SICK should be the designated number to reach me. At that point, we will assess your symptoms by phone and determine a plan of action. Bus riders will have their temperatures checked before boarding the bus. If any student has a temperature of 100.4 or greater, our hope is that a parent is still at home and able to have the student return home. If the parent is not at home or unable to be reached quickly, the student will sit in a designated seat on the bus and their school will be notified so that the student can be met at the door and walked to one of the isolation rooms for further evaluation by a school nurse. All bus riders and the bus driver will be wearing masks throughout the ride, and all buses will be sanitized after each route. All students, except bus riders, will have their temperature monitored in the vestibule leading into each building. Again, with a temperature of 100.4 or greater, the student will be taken to an isolation room and further assessed by the school nurse and a parent contacted to determine the next plan of action. We are hopeful that with enough thermometers and assistance at the start of the day, this will be a fairly organized and timely process while students continue to social distance in line and wear masks. Throughout the day, if a student is not feeling well, they may very well need to be assessed by the school nurse. If a student appears to be having one of the three most frequent COVID symptoms, we ask that you contact the front office or the nurse's office and let us know that you are sending a student with symptoms so that the student may go directly to an isolation room for further assessment. Those three most frequent symptoms include chills or fever, cough, and shortness of breath. Several factors will go into determining that a staff member and/or student will be excluded from school and for how long. Staff and students with symptoms will be asked to contact their primary care physician, and a plan will begin to determine if COVID testing is necessary or if symptoms need to be monitored at home. Nursing staff will be in communication with that staff member or parent, monitoring symptoms and coming up with a timeline of returning to school. If we have a positive case in a building, we will determine what areas of the building have been exposed, and the health department will help us to determine if parts of a building or all of a building need to close for 72 hours or longer for deep cleaning. Through what is called contact tracing, we will work in conjunction with the Douglas County Health Department to determine contacts and family members of a positive case and other students and staff that may need to quarantine and monitor for symptoms and/or be tested. During the school day, masks or face coverings need to be worn by all students and staff upon entering a building. It is important that they cover both the nose and mouth, so please remind students to do so. If you are a staff member in the building at times other than the school day, you may be without your mask in your workspace, but I would have it readily available in case someone were to enter your classroom or workspace. Students and staff will be required to wear masks throughout the school day, except when eating and when outside and able to social distance greater than 6 feet outside. On a side note, many of you are probably wearing masks that have been given out around Baldwin. Some of you have even been one of the many volunteers that have sewn those masks, so thank you very much. This large group of volunteers through the Lumberyard Arts Center have made more than 7,000 masks over the course of 4 months. Through their hard work, they will be providing at least 4 masks to each student and staff in the district. The district has face shields available for staff that might want to wear one. Just know that if you choose to wear a face shield, you will also need to wear a mask. Please contact your supervisor or administrator for a face shield. The CDC, KDHE, and the Douglas County Health Department are all requiring that students and staff practice good hand washing at least hourly during the school day. The best line of defense against the SARS virus and other germs is soap and water for 20 seconds. If that is not readily available, hand sanitizer is our next best option. Each building will have a plan and schedule for hand washing and sanitizing. Over the next weeks before school starts and throughout the school year, we will be continually communicating with staff and parents through email and Aptogy, providing COVID updates, asking parents to monitor for symptoms before school, and other helpful suggestions that will make the school year run more smoothly. I hope this information helps paint a picture of what our school days ahead will look like. There are a lot of unknowns still as we continue to combat the spread of COVID, which adds a lot of stressors that aren't normally there. As the school nurse, I cannot sign off without asking each of you to take time to take care of yourselves. Feel free to contact me by email if you have any other questions or concerns. And as always, stay positive and test negative. We've got this.